The bones that make up the knee joint are the femur, the tibia, the fibula, and the patella. In this video, we are going to study this region from various perspectives. We will start with the most relevant structures of the osseous anatomy and work our way through the cartilage, the synovial capsule, the fibrous capsule, the menisci, and the ligaments. The distal end of the femur has two condyles. The anterior surface of the distal femur corresponds to the patellar surface. It has the shape of a trochlea with a vertical groove and extends proximally, spatially, in a lateral condyle. From an axial standpoint, the anterior articular surface of the femur with the patella can be seen as a concavity. The tibial surface of the femur is divided by the intracondylar surface, which is continuous with the anterior patellar surface. Both condyles have similar curvatures in the frontal plane. The femoral condyles are posteriorly separated by the intercondylar fossa. They project beyond the posterior surface of the shaft. The lateral condyle has the lateral epicondyle, where the collateral fibular ligament inserts. It has the groove for the tendon popliteus between the lateral epicondyle and the articular surface. Thus, as seen from lateral, the tendon popliteus is deep to the lateral collateral ligament, and its insertion is more inferior and anterior at the lateral surface of the condyle. Above and posterior to the medial condyle, we find the abductor trabecle for the insertion of the abductor magnus muscle. The medial epicondyle is anterior and inferior to the abductor trabecle. It is the place of origin of the tibial collateral ligament. From a distal view, as seen from the front of a flexed knee, we can observe that the medial wall of the lateral condyle has the posterior superior impression for the insertion of the anterior cruciate ligament. The medial wall of the medial condyle has the anterior impression for the insertion of the posterior cruciate ligament. The proximal tibia has two corresponding condyles. From a superior view, we can appreciate the medial and lateral articular surfaces, the intercondylar area, which is not in contact with the femur, and the intercondylar eminence, consisting of the lateral and medial tubercles. At the lateral surface, we can find the fibular articular facet, which faces posterior laterally, the intraosseous border, which is the margin for the attachment of the interosseous membrane, and Gerdy's tubercle for the distal attachment of the iliotibial tract. The tibial tuberosity for the insertion of the patellar tendon is located anteriorly. The posterior surface of the tibia is concave and smooth. In the most proximal area, we can find the insertion of the posterior cruciate ligament. Distally is the popliteal ridge. The patella is a large sesamoid bone that is embedded in the tendon of the quadriceps femoris. It is flat and distally tapered. The anterior surface has multiple small holes for the passage of vessels. The posterior surface articulates with the femoral trochlea. and has a vertical ridge which fits into the intercondylar groove. The main surfaces are the lateral facet, which is larger, and the medial facet. The odd facet is a narrow articular strip at the medial border. The apex is located distally. It is a rough surface where the patellar tendon inserts. The superior border is thick and slopes antero-inferiorly. The medial and lateral borders are thinner and converge distally at the apex. The center of the knee is normally located in the load axis between the hip and the ankle. Both tibiofemoral joints form a bicondylar joint in a plane that is horizontal. As there is an angulation between the neck and the diaphyses of the femur, the femoral shaft is angulated respective to the horizontal plane, normally 97 degrees as measured internally. This is thanks to the fact that the medial condyle projects distally more than the lateral condyle. The knee consists of the tibiofemoral joint, the patellofemoral joint, and the proximal tibiofibular joint. The tibiofemoral joint is that between the distal femur and the proximal tibia. It is a synovial bicondylar type of joint. In this frontal view, we can see that the articular surfaces covered with cartilage are the trochlea and the condyles of the femur. The external facet of the trochlea has a broader surface. The superior surface of both tibial condyles are covered with cartilage. From a frontal perspective with the knee flexed, we see that the distal and posterior surfaces of the condyles are covered with cartilage in continuity with the trochlea. We can also observe that the lateral surface of the trochlea is wider than the medial side. Looking from superior at the proximal surface of the tibia, we can see that the cartilage covers the lateral and medial condyles. The anterior and posterior intercondylar spaces are not in contact with the femur. The menisci are moon-like shaped fiber cartilaginous structures in between the femur and the tibia. They have two insertions at the anterior and posterior intercondylar regions. The lateral meniscus is more narrow and has less separation between the anterior and posterior insertions and has a gap in the capsular insertion so that the tendon of the popliteal muscle can pass through. The anterior intermeniscal ligament lies in the anterior intercondylar region and connects the anterior horn of the lateral and the medial meniscus. The meniscus coronal section has a triangular shape. The meniscal peripheral ridge, or its most superficial region, inserts into the articular capsule. The function of the menisci is to provide congruity to the articular surface of the distal femur and proximal tibia, spread the weight load, and stabilize the tibiofemoral joint. To sum up, all the articular structures that we can see from a superior view of the proximal end of the tibia are as followed. The articular surface of the lateral condyle, the articular surface of the medial condyle, the insertion of the anterior cruciate ligament, the insertion of the posterior cruciate ligament, the anterior insertion of the medial meniscus, the posterior insertion of the medial meniscus, the anterior insertion of the lateral meniscus, and last, the posterior insertion of the lateral meniscus. The main ligaments of the knee are the cruciate and the collateral ligaments. The posterior cruciate ligament inserts at the posterior surface of the tibia and goes to the lateral surface of the medial condyle. It prevents the tibia from sliding posterior to the femur. The anterior cruciate ligament has the distal origin at the anterior intercondylar surface and inserts at the medial surface of the lateral condyle in its most posterior area. It prevents the tibia from sliding anterior to the distal femur. The anterior meniscofemoral ligament, or ligament of Humphrey, is located anterior to the posterior cruciate ligament. The posterior meniscofemoral ligament, or ligament of Risberg, is posterior to the posterior cruciate ligament. As a result, the posterior horn of the lateral meniscus is connected to the lateral aspect of the medial femoral condyle, close to the femoral attachment of the posterior cruciate ligament. These meniscofemoral ligaments are important accessory ligaments of the knee. In a sagittal plane, we can see again that the anterior cruciate ligament, or ACL, inserts anterior at the tibia and posterior lateral at the femur, and prevents the tibia from sliding anterior to the femur. The posterior cruciate ligament, or PCL, inserts at the posterior tibia and goes anteriorly to the internal surface of the medial condyle, and prevents the tibia from sliding posterior to the femur. And so, the cruciate ligaments cross over each other in the lateral and frontal plane. The lateral or fibular collateral ligaments inserts proximally at the lateral epicondyle of the distal femur and distally at the lateral surface of the head of the fibula, not at the tibia. It stabilizes the knee in the frontal plane, preventing varus instability. The medial collateral ligament inserts proximally at the medial epicondyle and inserts distally at the medial margin of the medial tibial condyle, and has a secondary insertion more distal, leaving a free space in between these two insertion points. It prevents the knee from valgus instability. The lateral collateral ligament is round and has a cord-like structure. The medial collateral ligament, on the other hand, is wide. The posterior fibrous capsule prevents the hyperextension of the knee. It is a wide and thick structure spanning from the posterior surface of the distal femur to the posterior surface of the proximal tibia. The oblique popliteal ligament is one of several specific posterior structures. It originates medially as an expansion of the tendon of the semimembranous tendon and goes lateral and superiorly into the fibula as sesamid bone. The synovial membrane inserts along the edge of the cartilaginous surfaces. As for the tibia, the synovial membrane goes all around the edge of the condyles. At the posterior region, it follows the internal edge of the medial condyle, crossing anteriorly to the lateral condyle, thus surrounding the tibial insertion of the cruciate ligaments. At the distal femur, the synovial membrane inserts along the edge of the trochlea, around the lateral condyle, posteriorly into the intercondylar notch, and again around the medial condyle. This distribution implies that the cruciate ligaments are extrasynovial. In fact, they're lined by the synovial membrane, and at the same time, they are turned out to be interarticular. The main movement of the knee is flexion and extension. During this movement, there is also gliding of the meniscus. During flexion, both menisci move from the anterior area of the tibial plateau to the posterior area. However, they both move in different ways due to their different morphology, insertion sites, and stability, as previously mentioned. The lateral meniscus moves approximately 11 millimeters posteriorly, while the medial meniscus only moves around 5 millimeters. Also, during flexion, the femur glides posteriorly over the tibia. This is known as posterior rollback. The posterior rollback determines the point of terminal flexion. It is essential for deep bends like squatting. Summarizing, there is very little movement in the frontal plane, meaning adduction or abduction, since the joint is bicondylar and stabilized by the collateral ligaments. The anterior or posterior gliding in the sagittal plane is limited and stabilized by the cruciate ligaments. The medial or lateral gliding is limited by the cruciate and collateral ligaments. The patellofemoral joint is a trochlea. The posterior surface of the patella is covered with cartilage, except for the distal apex. It articulates with the trochlea of the distal femur, gliding over the femoral trochlea during flexion and extension. The synovial membrane inserts around the cartilaginous surface. The patella is a sesamoid bone included within the extensor mechanism. It unites to the tibia through the patellar ligament or tendon. This tendon is the continuation of the quadricipital tendon and inserts proximally at the apex of the tibia and distally at the tibial tuberosity. Proximally, the synovial membrane progresses under the quadricipital tendon, forming a recess. It allows the extensor mechanism to glide through flexion and extension. The space between the patellar tendon is occupied by fatty tissue. The prepatellar bursa is anterior to the patellar tendon. It allows gliding of the skin over the tendon and tibial tuberosity. In full extension, the patella is in contact with the anterior surface of the femur above the trochlea. During flexion, it fits into the trochlea. In full flexion, it is in contact with the distal surface of the condyles. The patella is stable in the frontal plane thanks to the respective sagittal ridge of the patella and the groove of the trochlea. This stability is further ensured by the patellofemoral ligaments, one medial and another lateral. They insert at the medial or lateral border of the patella and into their respective epicondyle. The anterior lateral ligament originates from the lateral femoral epicondyle, slightly anterior to the origin of the lateral collateral ligament. It has a distal and oblique course to the anterolateral aspect of the tibia, where it inserts midway between Gerdy's cervical and the tip of the fibular head. When crossing the knee joint, the anterolateral ligament has firm attachment to the lateral meniscus. The proximal tibiofibular joint is plain. The articular surface of the tibia is located posterior lateral, not just lateral, under the posterior overhand of the tibial plateau respective to the tibial shaft. This joint is surrounded by the synovial and fibrous capsule. Distally in between the tibia and the fibula is the Intraosseous Membrane, which separates the anterior and posterior muscular compartments of the leg.